Welcome to recognition of normal versus abnormal pediatric ECG parameters. This course has been developed to give you confidence in interpreting pediatric electrocardiograms, a skill that is very different from interpreting adult ECGs. Across the next 2 CPD hours, we will explore age-specific ECG values, learn to recognize normal variants, avoid common pitfalls, and apply a structured stepwise framework. By the end of this course, you will be able to identify what is normal for children at different stages of growth and recognize when findings warrant further action or referral. Who should take this course? This course is intended for healthcare professionals who encounter children in their clinical practice. It has been designed for registered nurses, pediatricians, and pediatric registrars. Emergency department clinicians and general practitioners working with children will also benefit greatly from this content. In addition, medical students, clinical educators, and rural and remote health workers will find the course highly relevant to their practice, especially where access to pediatric cardiology support may be limited. Why this course matters. Pediatric ECG interpretation is not the same as adult ECG interpretation. The developing heart changes significantly from the neonatal period through adolescence, and these changes are reflected in the ECG. If adult norms are applied to children, normal pediatric variants may be misclassified as abnormal, resulting in unnecessary investigations, inappropriate referrals, and anxiety for families. At the same time, genuine abnormalities may be overlooked if they are mistaken for normal age-related changes. This course will help you recognize normal age-specific ECG values, differentiate between normal variants and pathology, and avoid the most common pitfalls. Ultimately, the knowledge you gain will strengthen your ability to make safe and confident clinical decisions for pediatric patients. Module 1. Introduction to Pediatric ECG Differences. In this module, we begin by looking at the fundamental differences between pediatric and adult ECGs. Children's hearts undergo significant developmental changes, and these directly affect the ECG. For example, newborns are right heart dominant, which produces right axis deviation that would be abnormal in adults but is normal in neonates. As children grow, left ventricular dominance develops and the axis shifts accordingly. We will also explore the common pitfalls of applying adult reference intervals to children's ECGs, which often leads to overdiagnosis of conditions like ventricular hypertrophy. This module provides an overview of age-stratified interpretation, setting the foundation for the detailed modules that follow. Module 2. Age-specific normal ECG values. This module explores normal ECG values in detail across different pediatric age groups. We will examine normal heart rate ranges for neonates, infants, children, and adolescents, and how these change as the heart matures. You will learn about the normal axis at different ages, such as right axis deviation being normal in newborns but resolving as the child grows. We will also review PR intervals, QRS duration, and QTC values, all of which vary by age. Finally, we will look at expected voltage changes, including why thin chest walls in younger children can produce high voltages that may mimic pathology. By the end of this module, you will have a clear understanding of what constitutes normal values across pediatric age groups. Module 3. Recognizing normal variants. In Module 3, we focus on normal variants that can easily be mistaken for pathology. You will learn about the juvenile T-wave pattern, where T-waves are inverted in leads V1 to V3, a normal finding in children that can persist into adolescence. We will explore right ventricular dominance at birth and when it is expected to normalize. You will also learn about sinus arrhythmia, a common and benign finding in children where the heart rate varies with respiration. Finally, we will discuss high voltages in thin-chested children, which may look abnormal but are in fact normal for their body habitus. Recognizing these variants is essential to avoid unnecessary investigations. Module 4: Misinterpretations and Clinical Pitfalls. This module highlights the most common errors clinicians make when interpreting pediatric ECGs. We will work through case examples where normal findings were misclassified as pathology, such as mistaking juvenile T-wave patterns for ischemia, or reading neonatal right axis deviation as right ventricular hypertrophy. We will discuss how to differentiate between normal variants and true pathology, and the importance of knowing when to escalate uncertain findings to senior colleagues or pediatric cardiology services. By building awareness of these pitfalls, you can prevent misdiagnosis and improve confidence in your clinical practice. Module 5: Stepwise Approach to Pediatric ECG Interpretation. In Module 5, we introduce a structured, repeatable framework for pediatric ECG interpretation. The first step is to check the rate and rhythm, ensuring sinus origin. The second step is to review the axis and intervals using age-appropriate reference values. The third step is to assess voltages and morphology, noting any deviations from normal. The fourth step is to differentiate between normal variants and abnormalities. We will also cover how to document your findings clearly and accurately, ensuring both safe clinical practice and readiness for audits or case reviews. A structured approach helps reduce error and increases confidence in decision-making. Module 6: Clinical Scenarios and Decision-Making. This module applies your learning to real-life clinical scenarios. In the first case, we look at a 6-year-old presenting with syncope. Was the ECG finding a normal variant or a red flag? In the second case, we review a neonate with sinus arrhythmia and consider whether this is normal or requires further investigation. The third case involves an adolescent athlete with high-voltage ECG readings. How do you distinguish between a normal athletic heart and pathological hypertrophy? These case-based discussions will guide your decision-making and highlight escalation pathways when findings are uncertain. Learning outcomes. By the end of this course, you will be able to explain why pediatric ECGs differ from adult ECGs, identify age-specific normal ECG values for heart rate, axis, intervals, and voltages, recognize and explain common normal variants such as juvenile T-wave patterns and sinus arrhythmia, avoid common misinterpretations that arise from applying adult norms to pediatric ECGs, apply a structured, stepwise approach to pediatric ECG interpretation, make safe, confident clinical decisions, and escalate appropriately when necessary. CPD course assessment. At the end of this course, you will complete a short knowledge assessment. This will test your understanding of pediatric ECG norms by age, recognition of normal variants, identification of abnormal versus normal patterns, and your ability to apply the structured stepwise approach to case examples. Certificate and CPD credit. Upon successful completion of the course and assessment, you will receive a digital certificate of completion. This confirms 2 CPD hours in pediatric and adolescent ECG interpretation. Your certificate demonstrates competence in recognizing normal versus abnormal ECG parameters in pediatric patients and strengthens your professional practice in both acute and primary